good afternoon. I'm Jackie, your medical assistant tonight. Can I have you confirm your date of birth and your full name? Okay, perfect. Thank you. I am here to give you the seminar for UTIs. It will take about 10 to 15 minutes for me to explain everything with you. I have a brochure for you, which includes all the information on our PowerPoint today, as well as our website, our phone number, and our email is on here as well. Do you have any questions for me? Oh, okay, perfect. Then let's go ahead and start with this for you. Okay, so our PowerPoint is about UTIs tonight. So a UTI is an infection of any part of your urinary system, which includes your bladder, which is right here, your urethra, your urethra, and as well as the kidneys. So it's an infection that gets in those. It is a lot more common in women than it is in men. A UTI is usually caused by bacteria that enters the urinary tract through the urethra, which begins to multiply in the bacteria. They usually occur in women and affect the bladder and the urethra. We will get more in depth of what causes it and the types of UTIs you can have. There's 3 common types, and we will go through all of those. Here are your symptoms. UTIs don't always come with symptoms, but when they do, these are the more common ones. So we have strong, persistent urge to urinate. So you'll just feel like you have to go pee all the time, even when maybe your bladder's empty, you just feel the urge to go. A burning sensation during urination. Because you're forcing yourself to pee, it usually kind of burns. You're usually passing very small amounts of urine. So if your bladder's empty, of course, you feel like you have to go urinate. You're only gonna let out a very small amount of urine. Cloudy urine is also very common just because there's bacteria in it. Your urine will usually look red, sometimes bright pink, and sometimes even cola color, just really, really dark and potent. If you have cola colored urine, it's usually because there is blood in the urine. Then we got strong smelling urine. It will smell really strong just because there is a lot of bacteria in it. And then pelvic pain in women, especially around the pelvic bone. So you will have a bit of pain if you do have bacteria in there. So those are all of our symptoms. Remember, they don't always come with them, so you always just want to make sure that you're not going through any of these, and if you are getting any of these symptoms, you should go ahead and go with your doctor just so we could take a look at it. These are the types of UTIs that there is. Again, it is bladder. It isn't bacteria in the bladder. They travel up the urethra. I have a little photo here for you. And then sometimes you could even get it from bacteria from the skin or even your rectum. So you do want to be careful, and you do want to make sure that you're wiping from front to back. But some of the types of UTIs that we have are kidney. It's when you do have this, you have upper back pain, high and side pain. You have high fever. You'll be shaking, very, very chilly, and you will have some nausea. Then, of course, we have the one in the bladder, which you will have that pelvic pain, which we mentioned before. You have low abdomen discomfort, so the lower abdomen will feel very uncomfortable because feeling like you have to go urinate a lot. You have frequent pain during urination, so every time you go urinate, you're forcing yourself, which causes the pain. And then sometimes there will be blood in the urine if it is in the bladder. In the urethra, you have burning with urination and discharge, which we mentioned before. So these are some of the risk factors and complications that can happen with UTI, which is why you want to make sure that you are getting them treated by your doctor and you're not, just ignoring them, because they can come with a couple complications. We'll start off with complications. So if you have 2 or more UTIs in 6 months, or 4 or more in 1 year, that can lead to a further complication. You could get permanent kidney damage from acute or chronic kidney infections because of an untreated UTI, so you do want to make sure you get these treated. If you are pregnant and you have a UTI, you can have a premature infant, or you could deliver with low weight. So you always want to keep an eye on that during pregnancy as well. You could get urethral narrowing and sepsis, which is a life-threatening complication of an infection if it goes up to your kidneys and is untreated. So if you do have a UTI, again, you want to go get it looked at. Some of the risk factors are the female anatomy. Just because the female urethra is shorter than a male's, which shortens the distance for the bacteria to travel up the bladder, to reach the bladder. Sexual activity can be a risk factor as well. UTIs are more common in women who are sexually active than women who aren't. And also, new sexual partners increase the risk of a UTI. Certain birth controls that women take can lead to are risk factors. So, for example, the diaphragms can lead to a UTI sometimes, just because you could get bacteria in there, and you want to be careful with that. Also, spermicide can be a risk factor as well for UTI. If you are on one of these, you might want to look into getting a new form of birth control, just so you aren't at risk of a UTI. Also, if you have any urinary tract abnormalities, that can lead to that as well. Blockages in the urinary tract, a suppressed immune system because there is bacteria entering your body. If you've had a catheter inserted, that could lead to a UTI as well as any urinary procedures. Our next slide, we already went over prevention and treatments. So to prevent a UTI, you want to make sure that you're drinking lots of water, keep yourself hydrated. If you drink cranberry juice, that would be good as well, just because it has a lot of nutrients in it. Also, like I mentioned before, you want to wipe from front to back. Empty your bladder after intercourse. It's very important, just because there is bacteria, and you want to make sure you get that cleared out. So urinating after intercourse is very important. You want to avoid potentially irritating feminine products, so anything that is scented or colored, anything that's scented, you want to avoid. And as we mentioned, if you need to change your birth control, that's highly recommended, especially if you're using one of these two, just because they are more common to lead to UTIs. Here are references. This website is also on this little pamphlet that we're giving to you. It's right on there. You do have our phone number if you have any questions, or email if you want to go ahead and email us. We do have everything written on here for you, as you can see. We have what is it, risks, all the risks on there, causes, symptoms, treatments. And we didn't go over treatments, so we'll go over that. My apologies. So if you do get a UTI, there's two ways. Well, one way is to prevent a UTI, and the second way is if you get a UTI. So to prevent, you want to urinate after sexual activity, which we already mentioned. That's very important. Medication, if you do get a UTI, we give antibiotics or penicillin, which are given to stop the growth, and they kill specific bacteria which causes your UTI. Okay, is there any questions for me that I can answer before we finish up? All right, perfect. I hope you enjoyed our little slideshow. This pamphlet is for you. Have a good evening.